This is the Patient Involvement and Choice Award, and with me are Hayley Ormondy, if I said that correctly, and Director Prevention and Long-Term Conditions, South East London Integrated Care Board, and Paula Bryan, Founder, CEO of Carers for Carers, and this is through NHS South East London Integrated Care Board. Congratulations to both of you. I want you to describe, Hayley, what it is exactly, what it is you've done.
So we set out to establish women and girls health hubs off the back of the Women's Health Strategy and the sort of expectation that each integrated care board would set up at least one women and girls health hub sort of towards the back end of 24-25. And what we really wanted to do in South East London was not do a kind of tick box exercise. We wanted to ensure that whatever we did was sort of outcomes and needs driven, and that it was a true kind of genuine partnership effort. It wasn't just about resolving long waiting lists for gynecology, but we were really doing something that would address many of our kind of diverse communities who are underserved. We wanted to really kind of tackle their inequalities by working in partnership. So the work that we did was going out into communities, really understanding what is it that you find as the barriers to accessing healthcare, what would you want to see differently, how would you want your needs to be met. We ran focus groups, we ran targeted social media campaigns and surveys. We worked with community ambassadors and our voluntary community sector partners to make sure that we had really, really rich insight in addition to our kind of population health data to understand what we needed to do so that what the services we designed were wrapped around the needs of women and girls. And then we've continued to engage with women and girls throughout. So we've made sure that it's not just at the beginning of the process, but we're continuing learning, evolving, and bringing that insight into the work as it develops.
Paula, describe for me what that engagement looks like. What were the difficulties you had to overcome? What was the reception?
I think first I just want to acknowledge what Hayley is saying about the partnership and collaboration, because this really was a collaboration between the NHS local authority and the VCSE. I think the NHS brought the strategic overview, the investment, and the clinical expertise, and the VCSE brought our wealth of knowledge in relation to kind of how to engage communities and their needs and nuances. And trust was definitely viewed as an asset because people are at the heart of care and people are not homogenous. You know, a one-size-all is never going to work for everybody. So for us, we were able to use trust as an asset. The NHS trusted that we knew what we were doing, and our communities trusted that we had their best interests at heart. And because we started from the aspect of people, we knew about the people that we were engaging with. And, you know, therefore it was much easier for us. You know, one of the strengths of this programme is that across the region, we were able to offer different delivery models to the different communities. So, for example, at Carers for Carers, we ran a menopause programme for carers. So as well as looking at menopause through the lens of caring, we were able to take in the intersection of race, of health, of gender inequality. So we developed a bespoke programme that ended up with a group of women that were kind of really invested in learning about menopause, but also not only for themselves, but wanting to be ambassadors. And because of this, our challenges were less, the barriers were less, because we already knew our communities.
Hayley, what were they telling you were their priorities? What did they want when you reached them, when you got to them? What were they saying?
So it was very different depending on the life course, and we were quite purposeful in calling it a Women and Girls Health Hub. And what younger women were looking for was very different to, of course, what older women were looking for. What women from a Muslim background were looking for was very different to someone from a Bangladeshi community, where actually there is no word for menopause. So what we recognised was that there were some similarities in what people were saying. So they wanted to be heard and listened to. So going out and doing those outreach sessions, I was amazed just at how passionate people were in engaging in the conversation, because it was really important to them that someone was asking them the question. And they wanted to ensure that whatever we were doing recognised the complexities that women and girls actually have. Often we have caring responsibilities. Girls are in education, yet we organise our clinical services 9 till 5, Monday to Friday. Well, that's not going to meet women and girls' needs. They felt that they had been to receive services and hadn't felt listened to. We had women who had 7-8 years before being diagnosed with endometriosis. We had women who went on to have hysterectomies that really shouldn't have had hysterectomies. So, I think it was just that this is the time to do something different, and we need to think outside the box about how we're going to intervene earlier, and also how we can just have simple conversations and have peer support and almost normalise some of what can feel like quite difficult conversations to have.
Well, describe a hub for me. You've set up, I think it said in 2025, 2 co-designed pilot hubs. What are they?
I think go to you.
So I'll talk about the sort of overall hub model, and Paula can come in and talk a little bit about the outreach. So we have 2 hubs, one in Lambeth and one covering Bexley and Greenwich. So they basically are a hub that will receive referrals, triage those referrals, look at giving advice and guidance, and then if someone needs to be seen, they'll be seen in the hub. So instead of waiting for a hospital appointment for a gynecology or complex sexual reproductive health issue, they're seen in the community through a kind of one-stop shop model that looks at all of their holistic needs, including their well-being needs. And we also have an outreach component. So we recognise that if we were just relying on sort of traditional referral routes from GPs, that we weren't going to kind of meet the needs of all of our communities. So one of our hubs has a self-referral route, and then we also use our community ambassadors and our VCSE partners that go out into communities and offer sessions either through the VCSE or in partnership with the clinical hub team. And they will do sort of health promotion activities. We do health and wellbeing checks, and very much what the offering is sort of tailored to the needs of that particular community. We do a mix of sort of ambassadors, VCSE sessions, and then micro grants as well. So, for example, one of our projects in Lambeth was a micro grant for a young women's sort of sporting organisation encouraging young girls to participate in sport. So supporting coaching of the sporting staff to recognise how to deal with women and girls' health issues, so that girls experiencing heavy periods can still be in sport and not sort of have their quality of life affected by that. So encouraging them to understand some of the health elements so that they can support those young girls. So a bit of a mixed model, but Paula can probably talk to the outreach much better than I can.
No, I think what was really important was that we were going to communities where they were, and we weren't expecting them to come to us. And that made all the difference. We were giving people choices, we were talking to people, we were actually really listening to them and responding to those needs. And now, I mean, it kind of sounds obvious that, we've got services for women all under one roof, but, it's taken us a while to get there. And, hopefully this is something that we can definitely build on and use the people within our community to do that work as well.
It is incredibly wide-ranging. I mean, it almost doesn't do it justice, this, because there is so much more to it than you expect. Well, listen, thank you so much, and congratulations on this well-deserved award.
Thank you very much.
Thank you.